Okay, before I get on scene, I'm going to make sure I have my BSI or PPE. Then, as I'm going, I'm going to assure scene safety. I'm going to figure out my number of patients, look for an MOI or NOI. I'm going to consider additional resources and C-spine stabilization. And I don't think he needs C-spine stabilization because he's sitting upright, moving around. And I probably don't need additional resources because there's only one patient. Okay, as I get there, I'm gonna form my general impression as I'm walking up. Then I'm gonna go and say, "Hey, I'm Brennan from Edge of the Ambulance. How are you?"
I'm good. How about you?
Oh, good. Do you remember why you called us?
I have severe pain in my left side of my chest.
Okay, and then during that, I figured out his chief complaint and his level of consciousness. He's alert. And then, we're gonna go through the ABCs. His airway's patent because he was talking. I'm gonna look at his chest and figure out his rate of respiration for breathing. And I'm also gonna hook him up to a pulse oximeter for his blood oxygen. Then we're gonna check his pulse. Can I check your pulse?
Yes, sir.
Thank you. Which is, what's his pulse? Just tell me.
24.
Fast.
110.
Okay, it's 110, which is high. And then we're gonna look for bleeding too. And we're also gonna check his skin quality. We're gonna look at his capillary refill here, which is good. His skin is cool, clammy, a little pale. So, and then we're gonna start with the assessment. We're gonna go through OPQRST, followed by sample. Can you tell me what you were doing when your pain started?
I was mowing my lawn.
Okay. Does anything make the pain better?
No.
Does anything make it worse?
When I move around.
Alright. Can you tell me what kind of pain it is? Is it crushing, dull?
Stabbing.
Stabbing? Alright. Does the pain go anywhere?
It radiates down my left arm.
Your left arm, okay. On a scale of 1 to 10, 1 being not so bad and 10 being the worst pain you felt in your life, how would you rate your pain?
9.
A 9, okay. And how long has the pain been going on?
Probably like 2 hours.
2 hours? Okay. Do you have anything else?
Nope.
Okay. He's only has chest pain and stuff. He seems like he's breathing fine. And what was his respiration?
24.
24, okay. So I might consider to hook him up to oxygen at 15 liters with a non-rebreather. We're gonna go into sample. Can you tell me about your symptoms?
Yeah, I just have pain in my chest.
Just chest pain?
Yeah.
Alright. Are you allergic to anything?
No.
No?
No.
Okay, are you prescribed any medications?
I'm prescribed nitroglycerin and baby aspirin.
And are you taking those?
No.
Okay. Do you have anything in the past that would be important medically?
I had a heart attack like a year ago.
A year ago. Alright, what was the last thing you ate today?
I had eggs for breakfast.
And did you have anything to drink with that?
Milk.
Okay. And can you tell me again the events that led up to the pain?
I was just mowing my lawn with my push mower, and then my chest started hurting, so I went inside, maybe thinking that would make it feel better, and then it didn't. It just got worse, so I called you guys.
Alright. Then we're gonna go into his vitals. We're gonna take a pulse, which is 24, we'll say. Okay.
110.
110, yes, sorry. 24, not 24, sorry. Okay, then we're gonna get a blood pressure too. Can I use this arm?
Yep.
Okay. Blood pressure. And his blood pressure is
140 over 80.
140 over 80, which is kind of high, yeah. And while we're doing that, we're also gonna look at his chest and get his respiration rate, and we're gonna also check out the quality. I might also listen to the lung sounds with the stethoscope, but I'm not going to do that right now. And then we're going to get my field impression, which is that his pulse is fast and his blood pressure is high, which could be a cardiac problem. And then my intervention would probably be to call medical control and get authorization to give him his nitroglycerin. And we go through the 5 rights, which is the right patient, right time, right dosage, right medication, and right route of administration. And if those are all right, I'm gonna give it to him. I'm gonna have you put this under your tongue, don't chew or swallow it. And then once we've completed our intervention, we're gonna call up the hospital, say how far we are out. I'm gonna give the hospital the patient's information and their condition. We're good, right? Oh, I'm gonna reassess every 5 minutes because the patient is critical, and if he was non-critical, I'd reassess every 10 minutes.